Good evening, I'm Haryanto Diman with a special edition of The Big Story. Nearly all foreign workers will have been cleared of Covid-19 by tomorrow, with the vast majority of them set to return to work by the end of August. Education Minister and co-chair of the Multi-Ministry Task Force, Lawrence Wong, said today that this means construction activities and projects should be able to resume soon, which will see added precautions in place.
Just because we have COVID-cleared dormitories doesn't mean that we should assume these are permanently COVID-safe dormitories, because we all know that the virus can flare up again, and that's why we are putting in place safeguards, particularly to ensure that all the workers in the dormitories will still be taking routine and regular tests once every 14 days. So that process and that regime, on top of all the safe management practices that are in place, will continue. At the same time, for all of us in the community, we again must not be complacent. By about the second half of August, as I said, with the dorm cases tailing off, we should see the total number of cases in Singapore coming down. Not just the cases in the community, but the total number of new cases every day should come down significantly by end August. But that is not reason. That is not a reason for us to be complacent or to let our guard down.
And giving an update on the progress of ensuring the dormitories are free of Covid-19, Mr. Wong said all residents have been tested, but one group remains in isolation who will be tested one more time. This could result in fluctuating case numbers over the next 2 weeks.
We may pick up cases from this group, and that's why we said that in the next 2 weeks or so, numbers may be volatile, because depending on what we see from the final test results, you may see a sudden spike, we may see nothing, we don't know.
The task force also confirmed that Malaysians who enter Singapore under the upcoming Green Lane arrangements and develop infection within 14 days would be regarded as imported cases. Set to start on August 10th, the agreement between Singapore and Malaysia will see the opening of applications for cross-border travel. Amid public concern over imported cases, the Health Ministry's Director of Medical Services, Associate Professor Kenneth Mark, said that adequate mitigating arrangements would be in place to limit a possible spread.
We do have various mitigating arrangements, even in the setting of these Green Lane arrangements. The itinerary for these people coming in on these arrangements is strictly controlled. The companies, in fact, sponsor them on these Green Lane arrangements. They take on the responsibility to make sure that where they visit, where they go, there are fixed itineraries to allow to mitigate that risk of exposure and then of spread as well. When they come back into Singapore, there are testing regimes that allow us to pick up cases as they arise and then subsequently quickly isolate them. We think that while there is obviously a risk with every visitor coming into Singapore, even under a Green Lane arrangement of importation of COVID-19, we think that risk is mitigated and we will be monitoring the situation quite closely. We are working closely with our Malaysian counterparts.
From August 10th, the Malaysian citizens and permanent residents with work passes here will only need to serve a stay-home notice period of 7 days when they enter Singapore. And the task force said this was decided based on risk assessment. Meanwhile, starting tomorrow, Singaporeans and permanent residents who develop COVID-19 symptoms when they return from permitted countries can tap on government subsidies, including MediShield Life, to pay for their treatments. The government has until now been bearing the full costs of inpatient medical bills for Singaporeans and PRs who require treatment at public hospitals. The new charging policy applies to individuals who exit Singapore under permitted travel arrangements, which include the bilateral schemes with Malaysia and China.
From 7 August, all outbound Singaporeans, PRs and long-term pass holders who travel abroad under the permitted travel arrangement, such as that under the bilateral arrangements with Malaysia and China, will be able to tap on the regular healthcare financing arrangements for their inpatient medical bills should they have onset of symptoms within 14 days of their return to Singapore and require hospital admission for suspected COVID-19 infection. This means that Singaporeans and PRs will be eligible for government subsidies and MediShield Life integrated shield plan coverage, and long-term pass holders may tap on their prevailing financing arrangements, such as the foreign worker insurance, but any remaining co-payment will continue to be paid by the patient. Those who are not under the permitted travel arrangements and instead travel in breach of the travel advisories will continue to pay for their COVID-19 inpatient medical bills in full. In addition, short-term pass holders entering Singapore under the permitted travel arrangements will remain responsible for their medical bills should they test positive for COVID-19 within 14 days of arrival in Singapore.
Separately, the task force also stressed that working from home should continue to be the default arrangement unless employees have a need to return to the workplace, for instance, to use specialized equipment. According to the panel, working from home has been beneficial on numerous fronts, like reducing congestion on public transport and minimizing the number of people gathering at the workplace. Now, you can visit straitstimes.com for more details on today's press conference. You can also watch the full press conference on our YouTube channel later tonight. Remember to subscribe by hitting the red button below. Once again, I'm Haryanto Diman. Have a good night.